Once again, thank everyone for joining today. My name is Jaquarius Jackson. I work as a wellness advisor too on the wellness team for Baylor Scott and White. Today, guys, we have a really special presentation. We actually have two guest presenters today on our presentation today. The first presenter I want to present today is Hayden Mix. She's actually going to spend some time talking about today over what to do in the case when you call 911, that kind of emergency dispatch conversation. So Hayden, I'll go ahead and hand it over to you and let you introduce yourself to everyone today.
Yeah, hi, my name is Hayden. I am a dispatcher for the 911 Bell County 911 Center. We are based out of Belton, and I've been there for about 2 years now, so I'm really excited to be here with you all today. And today I'm just gonna kind of talk to you all about the basics of calling 911, how it all works, what to expect, and then we're gonna talk a little bit about heart emergencies. So we'll go ahead and just jump right on into it. First, I just want to talk to you a little bit about our dispatch center. So the Bell County Dispatch Center has been around since 1999. This was actually the very first consolidated dispatch center in the United States. And basically what that means is we were the first people ever to dispatch fire, police, and EMS in the same building, as well as take emergency calls. A lot of other dispatch centers today still you'll call in and they'll first ask you, do you need police, fire, or EMS? And then they route you over to the necessary person. Our dispatchers are all trained to take police, fire, and EMS emergencies, so you're not being transferred from one person to another to another. It's just a really frustrating process when you have to do it that way. So when you have it consolidated like this, it's a lot easier for everybody. We've also just been kind of the role models for a lot of different agencies. A lot of people have modeled their dispatch centers after ours, which is a really, really cool thing. So the way ours is kind of set up is we have people who are primarily call taking and people who are primarily dispatching. So while you're talking to a call taker on the phone, they're typing in notes and it's going straight to the dispatcher. So you don't have to wait until you're off the phone for help to be on the way. As soon as we hit enter on that call, somebody's already being sent over to you. Each year we answer approximately 200,000 emergency calls. And we're just going to kind of go over the basics of 911, the importance of the caller's location, calls for chest pain, and then a couple of main takeaways. So this first thing I want to show you is a system called Vesta. This is our phone system. It's not our particular phone system. I wasn't allowed to take a picture of ours just for privacy purposes. So I found this one online, but it's close enough. So on the bottom half of this here, you can see there's all these different boxes. This is where the 911 calls come in on. When the phone is ringing, it's going to come in as a red box. As soon as it's answered, it turns that orange color. So they're going to start in the top left and start ringing. As calls come in, they filter in horizontally, go to the next line, and they just keep on filling up. These are customizable for each agency. So again, ours doesn't look exactly like this. On ours, you're going to see the 911 calls coming up at the top, and then on the bottom, we have different transfer buttons for our most common calls to transfer out to other people. We also have quick buttons for calling record services or conferencing and voice, translation lines. Be looking at the map of Bell County, these are all the areas that we service. So Bell County has 61 separate law enforcement, fire, and EMS agencies that we have. We have Troy, Temple, Morgan's Point, Belton, Holland, Little River, Bartlett, Rogers, Harker Heights, Nolanville, Colleen. And all of those cities are lit up in a different color. All of the gray area that you see is going to be the county area, and that's what the Bell County Sheriff's Office covers. We also dispatch for DPS, the Corps of Engineers, Parks and Wildlife, and a couple of different constable agencies. This is going to be my personal dispatch setup. So based on what you're doing that day, if you're call taking or you're dispatching, you're going to use two different programs. They're set up basically the same way, but dispatch has a couple more functions than call taking does. So in the top left box, this is what we call our active one box. When we get a call in for service, we're going to enter in all the information here. So the top line is going to be the caller's location. The bottom or the second line from that is going to be the event type. The third box is going to be the subtype. A lot of our event types have different subtypes. So if we have a domestic dispute going on, our event type is going to be domestic. The next line is going to be either a verbal, a report only, a violent, a domestic with weapons. And then the fourth line down is going to be where we start typing all the different comments, and they go into that big white box there. On the top right, it's the name box. That's where we're going to put in the caller's name. There's another box there for address. Sometimes we use that if the caller is not at the location that the emergency is at. So let's say we have somebody calling in a domestic dispute at 3808 Chaucer Drive, but the caller lives at 3810 Chaucer Drive. We'll just fill in the caller's address in case the officers need anything else from them. The third line is going to be the phone number, and then the call source is underneath that. At the very bottom, this big white box that we see here is where we have all of the active calls. Typically, we have about 30 to 50 calls, either pending or active at once. It really just depends on the day of the week and the time of day. The busiest time of day for us is going to be between 3 and 11 p.m. That's when all of the chaos breaks out and people are getting off of work. They're agitated. They're interacting with other people, and things just go wrong. So all the calls are going to be in there. Obviously, it's going to be left blank just for privacy purposes. We don't want everybody to know what was going on in Bell County on this day. To the right of that is what we have, where we have the supplemental information box. This is where we can put in people's names, vehicle license plates or VIN numbers, serial numbers for different property, contact information, things like that. So when we enter in a person, we're going to put in their first and last name and a date of birth. And when we do that, it's going to run it through the TCIC NCIC system. And that's just a system that's used nationwide. You can use it to enter in warrants, sexual offender registries, stolen vehicles, stuff like that. So when we run it, everybody across the nation can see, okay, this person has a warrant out of Arkansas for whatever it might be. And then we can go ahead and confirm all warrants that way. And then this top right section, I have 2 sticky notes. When I'm dispatching for several agencies at a time. There's up to 100 officers that I'm working with sometimes, and everybody needs something all the time. If I don't take down notes, I'm going to forget what they're asking me. So again, we're just going to kind of talk about some misconceptions of 911. You know, there's a lot of TV shows out there that portray 911 call centers. And unfortunately, a lot of those movies and shows get it very, very wrong. And so I kind of want to talk to you guys a little bit about the biggest misconception, and that's going to be location information. So again, location is something that a lot of people get very, very wrong. Media has made it seem like when you dial into 911, the call taker knows everything about you. We know what your address is or your exact location, what your full name is, and that's just not true at all. We don't have access to your phone's registration information. The only time we're going to see a name is if you call from like a landline, and then it might give us a name, but sometimes it's wrong. So what really happens when you dial is your phone begins to bounce off of different cell phone towers in the area, and it kind of narrows it down to one general location of where you are. And typically the location that we get is very accurate. We can typically get it between like 10 to 20 meters of where you really are. And when we do that, that's what we call a wireless phase 2 location. A phase 2 location is just a really accurate ping of where your phone should be. And so if we look at this picture here, I'm going to kind of just walk you through a little bit what you're seeing. Again, I couldn't take a picture of our system just for privacy information, but this is what we call an any alley box. This top phone number that you see here is going to be the caller's phone number. And then the bottom number that you see right below that is the number of the cell phone tower that they're pinging off of. The address that you see is going to be the address of the cell phone tower. And then over to the right of this, you see WPH2. This is telling us that it's a phase 2 location. And then it's also going to give us a confidence number. So it'll tell us it's 90% confidence that you're within 20 meters, 50 meters, however many meters it's confident. And then it also gives us lat and long information. So again, this is a phase 2 location. This is what we were going to see when your phone and the cell phone towers decide to play nicely together. When they don't, because we all live in a world of technology, we know that things don't always go well. We might get a wireless location. When we get a wireless location, this is a location of just the cell phone tower. This means that your phone, for whatever reason, is just not pinging correctly, and we can't get a solid location of where you really are. We're just seeing the nearest cell phone tower to you. Luckily, this doesn't happen all the time. And if it does happen, we have this update button on the any alley box, and we can keep on clicking that to try to get a better location. But again, it doesn't always work. For example, yesterday I had a woman who called in and I just had a wireless location. I kept hitting update over and over and over again because she had no idea where she was and I couldn't see where she was either, just because it wasn't updating. It took almost 2 minutes before I could finally get a solid location on her. So if you're going to call into 911, if you don't know where you are, it's okay. A lot of people don't. But we're going to keep on asking to try to tell us what you see around you just so we know for sure where you are. Another issue we've been having recently, about a week ago, we're not sure why still, but a lot of people who were calling from Temple were pinging in Fort Hood, and they're having to transfer all these calls over to us. It's just a cell phone tower thing. Again, technology, lots of different things can affect the way phones call in. So again, location is so important for us. If we don't have a location, we can still put in a call, but it's going to take a lot longer to get help to you because we don't know exactly where you are. And I also want to just kind of reiterate that even if we have a wireless phase 2 location, it's not always 100% accurate. A few weeks ago, I had a woman who was calling. She was living on 1st Street in Temple, but her location was showing on 3rd Street. Now it's only 2 streets over, but if she didn't know her address, then help is going to the wrong spot. So just try to get a good idea of where you are before you call in. It's going to help us. It's going to help the responders. And then calls for chest pain. We get a lot of medical calls throughout the day, and chest pain is one of the most common ones that we get. When anybody has any type of medical emergency, we're going to use an application called ProQA. This is a tool that most 911 centers are going to use, and it's been developed over many years by tons of different doctors. They come together, I think, annually, actually, to just review everything, make sure that everything is still up to date and the most accurate. And it just assists the call takers in asking different questions pertaining to different medical emergencies so we can better prepare the medical responders for the scenario that they're walking into. And then calls for chest pain. We get a lot of medical calls throughout the day, and chest pain is one of the most common ones that we get. When anybody has any type of medical emergency, we're going to use an application called ProQA. This is a tool that most 911 centers are going to use, and it's been developed over many years by tons of different doctors. They come together, I think, annually, actually, to just review everything, make sure that everything is still up to date and the most accurate. And it just assists the call takers in asking different questions pertaining to different medical emergencies so we can better prepare the medical responders for the scenario that they're walking into. So aspirin works as a blood thinner, and what it does is it prevents the platelets in your blood from forming clots. A lot of heart attacks are caused by a lack of blood flow to the heart. You usually get a clot somewhere, and so the aspirin is going to work to thin out some of that blood to prevent the heart attack until you can get to the hospital. So we will greatly encourage everybody who's at risk of heart attacks. If you're a man who is 45 years or older, or a woman who's 55 years or older, you're at a higher risk of heart attacks. Having aspirin on hand can really, really save your life. A lot of studies have shown that taking aspirin in some type of potential heart attack emergency can really increase your chance of survival. So before we give you the aspirin, we need to ask you a couple of questions. We need to first make sure that you're not allergic to aspirin, that you haven't been vomiting any blood or coffee ground material in the last 24 hours, and that you're not passing any black or bloody stool. We just ask these because these are potential signs of internal bleeding, and we don't want to make anything worse by giving you aspirin. If you're bleeding internally, aspirin can really just make that a lot worse for you, and we're not trying to give you more problems when you get to the emergency room. So after you've taken the aspirin, we're just going to give you a couple more instructions, put up any pets you might have, gather any medications, and have the front door unlocked for us. And so some main takeaways. The biggest thing I want to just share with you all is to not be afraid of calling 911. We have a lot of people who wait until the very last second to call. They don't think it's that big of a deal, or they're embarrassed. And then by that point, they're so far into whatever emergency they're having that we can still help them, but sometimes it's too late, and we don't ever want it to get to that point. We want you to call as soon as you start experiencing any of these symptoms. We'd much rather be safe than sorry. A lot of people are like, oh, I'm sorry, it's probably not a big deal, I don't want to waste your time. You're not wasting our time. This is what we're here for. We are here to help you. And the paramedics feel that way too. We want you to have the best chance of survival and the best chance of recovery. So please, any type of medical emergency or police emergency, give us a phone call. Even if you think it's nothing, call us because sometimes it is something and you could save your life, you could save somebody else's life. And so that's about all I have. Jaquarius, I'll pass it over to you.
All right. Thank you so much, Hayden, for all the information that you shared. And definitely, once again, thanks for your time. I kind of go over to the next slide here and open it up to any questions. I'm going to take a peek down at the chat. And we do actually have some questions for you, Hayden. I'll go the first one here. Hayden, what would you say are some of the most common calls that you get? And then what was what was one of your most memorable calls?
Yeah, so most common calls, I would say, calls for shortness of breath, calls for chest pain are always very common. We also get a lot of seizures in this area. And then aside from that, just regular police emergencies. We get a lot of domestic situations in this area, um, or just regular disturbances. You know, people go out to a store, they get into an argument with somebody, or we have we have a lot of people who will go out to fast food restaurants and they get their order wrong and the manager won't give them a refund. They call 911 about that. Just little stuff. Just yeah. Most memorable call. Um, I would say when I was in training, I was first learning how to call take and then learning how to dispatch. So still in my call taking training, and I got a phone call, and it was for a 19-year-old boy who had picked up a hitchhiker, and the hitchhiker was actually being pursued by PD earlier in the day, and he was trying to make an escape. Well, he ended up stabbing the 19-year-old in the neck, and the 19-year-old fell out of his car and there's a woman who's driving up right behind them. She jumped out and was trying to put pressure on the wound until EMS got there. Unfortunately, he did not make it, but I think that was the most memorable just because it was my first like really big call that I'd ever taken. I was so new at it, and I just didn't know what to do, and it was hard, but you kind of have to get used to stuff like that when you work this kind of job.
Gotcha. Thanks for sharing that, Hayden. I don't think I could get used to it. So I definitely congratulate you. If congratulate is the right term or words to use, but I think it definitely speaks to like how strong you are or like the strong spirit that you have to have with working like a job like that. So definitely kudos to you for that one. I think we have one or two more. Um, uh, how do we call in a non-emergency call?
Yeah, so you can always call into 911 even if it's a non-emergency. We get that a lot. Or you can call into one of our non-emergency lines. You can always just Google the phone number for your local police department and they can put in a call for you. Other than that, our direct line for the non-emergency is going to be 254-933-5570.
Right. And then one more, Hayden, when you get a chance. How does it work if you have a phone number with a different area code than the location you are in at the time of that call? Will 911 know that?
Yeah, so it's not gonna dial into the location where your area code is from. It's gonna again use the nearest cell phone towers to you. The only time that the area code might be an issue is if you're calling off of a landline. When you have a landline, you have to register that phone number with the phone companies in the area. Um, so I know that I think about a year ago, we had somebody who used to live in Killeen and their landline was registered out of Killeen still, but they had moved to Maryland. So when they called 911, it still came to us because their phone was registered here. But other than landlines, it doesn't matter where your phone is out of, it's going to use those cell phone towers as long as it's a cell phone.
Couple more minutes here before we'll lead it over to our next speaker. Does anyone have any additional questions? They do not. All right, guys. Hayden is going to hang around with us for a little bit while longer on our call. But Hayden, thank you so much for the presentation. We learned a lot of information. I learned some new things that I didn't know as well, especially about the non-emergency phone number. I didn't even know there were any of those at all. Anything non-emergency, I was like, I'm just going to hang back and maybe take some aspirin and figure it out later on. So definitely thank you for letting me know that was kind of available also. Our next guest speaker we'll have today is going to talk a little bit more about those situations to do in a cardiac event. We have Dr. Ira Bell, who actually works for the medical plan here at Baylor Scott and White. Dr. Bell, he actually has about 46 years of combined experience in the medical field. He has some different expertises in medical management, physical leadership, and then it's also held executive positions in both hospital and ambulatory care settings. His areas of expertise also are Medicaid management, strategy creation, application, CQI, peer review, and some other ones as well. He does report directly to the Chief Medical Officer here at Baylor Scott and White. Dr. Bill, do you want to kind of introduce yourself to everyone and then maybe add on to a little bit more things that the audience here would like to know about you as well?
Uh, I certainly appreciate the opportunity to join you today. I'm originally from Austin, more directly from Bastrop. I grew up on a farm. My father was a third-generation farmer. My relatives came here in 1858, so I think I'm a native Texan. I got as far away as Galveston for medical school and back here in Austin for my training, residency in family medicine. I'm the proud father of 4 children, one of which is a physician practicing in Chicago. One of my daughters is an attorney in the Woodlands in Houston, and the other is a dean of students at TCU. My son is a computer executive for NVIDIA, and my wife is a retired PhD educator. So I'm coming from a very blessed family. I wanted to talk to you for just a brief period about what I think is one of the most important 911 calls that anyone can make, and that is what happens when I come home from a hard day's work, having some chest pain. Should I call 911? Should I call my sister or best friend down the street? Or exactly what should happen when you think you're having heart emergency scenarios? So I'd like to spend just a little bit of time maybe going through a couple of scenarios related to heart emergencies. I think this is very important because one of the leading causes of death in both men and women are heart-related, coronary artery disease, including angina, atrial fibrillation, myocardial infarctions. All of those are very critical to, 1, recognize, and 2, take action. So perhaps we can do a sort of a back and forth of what should I do, what shouldn't I do, and perhaps with our 911 dispatcher can help us out with what kinds of questions do you think we should ask or should not ask, or what should we do in those emergencies? Let's start off with one very common scenario. I've had a hard day at work. Come in, I'm a 65-year-old male. I can't even remember when I was 65. And I have a history of hypertension, family history of heart disease. My father died of an acute myocardial infarction while at work. I've had a very big meal. I'm a little tired, and I'm having some difficulty with some fullness in my chest. I don't know whether or not that's indigestion. I don't know whether or not, because I work hard all day, if I'm having muscle pain here, or am I actually having a cardiac event? I do have some pain. It feels like it's like someone is sort of sitting on my on the middle of my chest, just a little bit to the left, and I'm having some radiation into my back and up into my neck. What do you think I should do? Does anybody have any questions, any answers to that scenario?
I don't know. I know for myself personally, Dr. Bill, like just like thinking in the typical like male aspect, I like am gonna like take a Tylenol and put on a heating pad and like go lay down for a little while, right? Because like I'm thinking like a man sometimes in that general space of like, oh, it's just not that big of a deal yet, and so I'm gonna go relax until it feels like a little bit more extreme. That would be my like kind of first go to sometimes.
Yeah.
What do you think about like those like typical like mindsets or ideologies that men have about like things like that?
And that's typically what I would expect. Uh, the problem, though, is that you have some, what should I say, red flags here. One of the red flags is that I'm at the age where you would expect something more than just fatigue and muscle strain. I'm 65 years old. I have a very strong family history of cardiac disease. A very red flag is sudden death of a first-degree relative. The other red flag that I would be worried about and that would give me pause for concern is that I have hypertension, very common. One of the questions, if you were to call your primary care provider, family physician, internist, what have you, the first thing they would want to know is, are you taking your medicine? The answer to that question is, well, sometimes I do. You know, doc, I only take my medicine when I feel that my blood pressure is up. I don't know how you determine that, but that's a very common response. And again, that's a red flag. That probably meant that I haven't taken my medication in quite some time. So the next question is, should I call 911? Well, that depends. More commonly than not, if you think you should call 911 and you think you have a cardiac event, you should. You only get a chance maybe once or twice to do the wrong thing. So it's very important to do the right thing first. The person on the other end of the line is very well trained, very knowledgeable, and will be asking very important questions to make a determination of whether or not you should go immediately to a center for further investigation, whether or not an ambulance should be called, or whether or not this might wait until you can call your primary care provider or family physician. The other important thing is you may or may not want to go to an emergency department. How close is an urgent care center near you? Urgent care centers are very well equipped to take care of minor emergencies. That's what they are there for. But they're also very well equipped and staffed with personnel that can help to differentiate whether or not this is something that should be urgent, and whether or not an EKG should be something that should be taken immediately to determine whether or not there isn't a possible cardiac event going on. So it's very important that those presenting symptoms are those that we should be very, very cognizant of. Not only am I having chest pain, but where is the pain? Is it in the center of the chest? Is it more toward the left side of the chest? Does the pain radiate? Is it accompanied with shortness of breath? Is it accompanied with dizziness, fainting, feelings of I'm all of a sudden I've got sweat pouring down my face? Those are very, very important red flags that deserve you calling 911 because this might be a heart emergency. Well, what if you don't have a lot of those symptoms? And the onset of the pain is not sudden in onset, but sort of gradual. I've had this pain all day, and I've kind of had this pain on and off for the last week. Those are very important questions that you should ask yourself and make a mental note of determining whether or not this is a cardiac event. If it's not a cardiac event, what might it be? It could be GI related, and perhaps one of the most common causes other than a heart emergency scenario of chest fullness or chest tightness might be related to the fact that you might have what we call heartburn, but more succinctly esophagitis, or a problem with the food sort of not going in the right direction. You're having some fullness with gas building up underneath the diaphragm, irritating the vagus nerve and masquerading as a potential cardiac emergency. It's very important to determine whether or not the pain radiates. A question that someone will ask you: is the pain moving? Does it move into your shoulders? Does it move into your neck? If you're a woman, does it move into your back? Or does it move up into your jaw? Of course, you can have a very significant cardiac emergency and not have pain at all. Those are very, very stressful. Do you feel your heart beating rapidly? Does it feel like it's beating out of control? Again, very important questions to ask, and those questions need to be answered. It's appropriate, in my opinion, at that time to call a person who can help you determine what the next step might be, and that will be calling 911. We should take these warning signs as signals to appropriately call 911 for further investigation or instruction. One of the more common events is whether or not this might be stress-related. The stress-related chest pains are a little different typically in its presentation in that it's not acute on its onset. It's caused by perhaps an emotional event, an argument, stress at work, stress with family members or the neighbor down the street. Now I'm coming in, I'm all tense, I'm a little short of breath. In fact, I'm almost hyperventilating, and now I'm having some chest pain. What should I do? Is this a reason to call 911, or is this a reason to maybe think, well, maybe this will pass? Again, these are all scenarios that I think we've all gone through, and we'll have that question: should I call 911? I know that I'm talking too much, so maybe some of you might be able to help me answer that question. What's happened in in your life that you've had to reach that fork in the road of, well, it's just gas and it'll pass away, or maybe this is a real event and I need to seek help?
Yeah, I do see a few different things in the chat, actually, Dr. Bill. So I see one, and I think you maybe slightly touched on it a little bit when you were talking about chess. But someone asked specifically, how can they tell the difference? How can they tell the difference between when they are experiencing um, an actual maybe heart attack or just an anxiety attack at that point in time? Like, are those symptoms the exact same? Are they similar? Like what is a clear indication between this is an anxiety attack or this is a possible heart attack? I need to seek immediate attention for it.
In those two examples, anxiety attacks, when I'm having chest pain, usually are not brought on immediately. This is the anxiety is something that is slowly built up over. When I say time, it could be hours or days, or but it's not just the sudden onset, striking out of the blue when I'm sitting calmly watching, the old issues of Terry Mason or All My Children or whatever. The cardiac event is sudden, most likely in onset. The pain is crushing, and it gets your attention. It's something that, for the most part, all of a sudden I'm having really, really bad chest pain. That pain is probably radiating. I'm having sweats. I'm having shortness of breath. I feel my heart beating really, really rapidly, and I know that I need to do something. That's one of the ways that I try to differentiate when asked that question, because as soon as you get to the emergency department, they're going to ask, what were you doing when this happened? What brought this on? Tell me about your day. Did you eat something that you think may have caused this? Did you just have an argument with, your daughter's boyfriend? Those are the questions that we're going to ask, and sometimes in your seeking to try to figure out why am I having chest pain, those are the questions that you'll ask. Also, the emergency department doctor or personnel will ask you, what medicines are you taking? What's your history? Do you have a history of heart disease? Are you taking, has someone diagnosed you as having angina? And are you using your nitroglycerin when you have these attacks? Do you have a family history of cardiac disease? Are you at risk for heart disease, overweight, taking various medications that are cardiac related? Those are some of the things that you really, really worry about. The other opportunity, especially in my age group and people as we age, and especially in women, is the fact that this might not be a heart attack, but you might be having something called atrial fibrillation. Atrial fibrillation is something that, and if you're lucky to have a watch that can measure atrial fibrillation, especially the Apple Watch, it can be a lifesaver. It will actually tell you whether or not you're in atrial fibrillation or not. My wife was such a person who was awakened at night by her Apple Watch in atrial fibrillation. And not only was she in atrial fibrillation, but we could send a very standard EKG to her cardiologist to confirm that this was atrial fibrillation. So all things that kind of go funny in your chest don't have to be a heart attack, but it might be cardiac related. And atrial fibrillation left untreated is just as deadly. So these are all important things that I think that we can sort of ask ourselves and then try to make a judgment of whether or not calling 911 if you think you're having a cardiac event is the right thing to do. Usually it is.
Yes. Thank you for that, Dr. Bill. I do have another question right here. Do you happen to know the reason why we may be seeing the younger population experience sudden heart attacks?
Yes. It's very interesting. During the Vietnam War, every soldier that was killed in action got an autopsy. And a surprising thing was noticed, that in these 18, 19, and 20-year-old men, we noticed significant coronary disease. That is, they had the blood vessels that supply the heart with blood had calcium and cholesterol plaques in them. This is very, so in essence, these young, very healthy men were seeing, we were seeing an abnormal number of these guys with hearts that looked like 40, 50, and 60-year-old people that were already starting to get plugged with fat deposits. What that meant was that the diet that these guys were raised on was unlike any other diet that that soldiers before them had seen. During World War II and the Korean War, when autopsies were able to be made, you didn't see this, but we saw in very high numbers advancing coronary disease and coronary vessel disease. This is probably more than anything else related to the diet, high in fats, and so one of the things that we know that's an early indicator is where our diet is not very, very healthy. You know, we grew up on McDonald's hamburgers, and that's probably not the best thing to do. But this is something that we saw very early on. So diet and lack of exercise, especially since, I mean, nobody does PE anymore in our schools. But diet and exercise are very important things that we should pay very close attention to avoid cardiac events in our 30s and 40s. The fact that manual labor is not one of the most important ways of making a living also gives us pause.
Dr. Bill, I know we talked a little bit earlier, just kind of scenario and maybe like an older male population with the chest pain. Are there any major differences when it comes to gender, when it comes to chest pains and cardiac events? Would there be a scenario to where a female may handle chest pains a little bit different than a male may? What are a couple of scenarios where that may look a little bit different just based off of gender?
I'm glad you asked that question because we've found recently, retrospectively, we know that there is a difference in men and women, as especially as we approach the age of in our 60s and 70s. We note that the size of men and women's hearts is basically different. And this can cause maybe a little bit of a difference in how these signs kind of approaches. One of the major differentials that we found is that women have a hormone called estrogen, and estrogen tends to affect the heart a little differently. One, the average female's heart is a little smaller than the male's heart. The walls are a little thinner related to when you look at the heart of a male typically and a female typically. And we think that that's due to the effects of estrogen. As women enter menopause and the estrogen level drops, now we're starting to see those differences manifest themselves. So women, and this is not a general rule, but more women have an atypical kind of a chest pain. The chest pain radiates, and it's not uncommon for them to have back pain, or the radiation moves toward the back. The radiation typically in males is more the standard kind of a vagus nerve distribution, and that is down the arm, usually down the left arm, radiating into the ring finger, because that's where the vagus nerve goes. Women tend to have more, again, fullness rather than the sudden, severe, suffocating shortness of breath and chest pain. Women tend to have more radiation into the neck and jaw than men, although it's not exclusive, but we tend to see a different distribution of pain. Women tend to have more what we have historically called silent attacks, where you may not have any pain at all, but all of a sudden you just don't feel right. Women tend to have more heart racing events rather than the pure pain events. Men would historically tell you, Doc, this is pain like I've never had before. I mean, it is really painful. Women will tend to tell you that on a scale of 1 to 10, I had chest pain, but it was probably a 5 and not a 9. And looking historically in the past, we think that probably has more to do with the effect that women have had almost a protective feature with the estrogens that they naturally produce that men don't.
Gotcha. Thank you so much for sharing that answer. I think that definitely helps me answer things a lot more. And I know we have quite a few ladies on the call as well. But thank you all again. Thank you as well as to Hayden. I know she went ahead and dropped off. And thank you, Dr. Bell, for your time. I know all of us are extremely busy during the day. So we appreciate when we're all able to come together, even if it is just for this short amount of time to kind of share information with each other. So we definitely appreciated the information, the value information. And I think we all were able to learn something today, even if it's just one thing. I think it's going to be able to help us kind of carry along and for sure save either our lives or someone else's in the future. Outside of that, guys, as usual, remember we have these webinars every single month, once a month on our Wednesdays.